Gentlemen, if you're a man over 60 and you've noticed changes in your intimate health, or if it's been months or even years since you've been intimate with yourself or a partner, I need you to stop what you're doing and listen closely. What I'm about to tell you could be the key to protecting your prostate, restoring your energy, and reclaiming a vitality you thought was gone forever. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men navigate the changes that come with aging. And here's something most men don't realize. Your prostate never stops working. Even after 60, it's producing seminal fluid every single day, maintaining a system that nature designed to stay active for life. But when you stop engaging with that natural biological rhythm, when months or years go by without regular release, something happens inside your body that most men never see coming. Pressure builds, inflammation begins, hormones shift, and slowly, that spark, that sense of being alive, starts to fade. In the next 20 minutes, I'm going to explain exactly why maintaining regular intimate health practices matters, what happens inside your body when that rhythm stops, and how to approach this safely after 60. I'll also reveal what it means when you experience a dry release, a condition that alarms many men but has clear medical explanations and solutions. Stay with me, because this isn't just about intimacy. It's about your prostate health, your hormones, your confidence, and your overall quality of life. Somewhere along the way, many men over 60 start to believe their intimate life is supposed to end. That physical intimacy, desire, and natural release belong to younger men. Maybe you've been told to slow down, as if aging means the end of vitality. But here's the biological truth. Your body was never meant to stop. Regular intimate activity regulates hormones like testosterone, dopamine, and oxytocin, the very chemicals that keep you motivated, calm, and emotionally stable. When that rhythm stops, testosterone drifts downward, dopamine levels flatten, and your mood shifts in ways that feel like aging, but are actually biological stagnation. I remember one patient, a 68-year-old man named Michael, who hadn't been intimate in over 2 years. He thought he was just getting old, but when we restored a healthy release rhythm, with simple lifestyle adjustments, something remarkable happened. Within 6 weeks, he told me, he felt like his body had finally woken up again. His energy returned, his sleep improved, and that quiet frustration simply lifted. Now, you might be thinking, Dr. Lila, does ejaculation really make that much difference? Let me answer with rigorous scientific research. Yes, it absolutely does. A Harvard University study followed thousands of men over multiple years. What they found was striking. Men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. We're talking about a measurable reduction in one of the most common cancers affecting older men. Why? Because regular ejaculation acts like a cleansing system for your prostate. Every time you release, you're flushing out old cellular debris, proteins, and metabolic waste that can build up and cause oxidative stress. Think of oxidative stress as rust forming inside your tissues, damaging cells, triggering inflammation, and creating an environment where abnormal cells thrive. This isn't alternative medicine. This is peer-reviewed science published in respected medical journals. In my decade as a urologist, I've seen how regular ejaculation improves symptoms in men with benign prostatic hyperplasia, that common prostate enlargement causing frequent urination and weak flow. Men who maintain a healthy release rhythm report better urinary function, less nighttime waking, and greater pelvic comfort. Your prostate depends on circulation. Blood flow increases dramatically during arousal and release, delivering oxygen to tissues and exercising the muscles that support your bladder and reproductive organs. Nature designed your body with a built-in maintenance system. Regular ejaculation is part of that design. Let me walk you through what happens inside your body when months or years go by without ejaculation. First, the normal process. Your testicles produce sperm. Your seminal vesicles produce most of the fluid. Your prostate adds protective fluid. Everything comes together in the urethra, and during climax, muscles contract rhythmically to propel everything outward. Precise coordination between nerves, glands, and muscles. When you stop ejaculating, your prostate continues producing fluid daily, preparing for a release that never comes. Over time, that fluid thickens inside the ducts, like water left standing in pipes. The ducts become irritated. Small areas of congestion form. Without movement, old cellular material accumulates. Blood flow to your pelvic region changes. During arousal, blood rushes in, bringing oxygen and nutrients. When arousal stops happening regularly, circulation becomes sluggish. The small blood vessels don't expand and contract properly. Oxygen supply drops. Without adequate oxygen, tissues become vulnerable to inflammation and damage. Your pelvic floor muscles also change. These deep muscles support your bladder, bowel, and reproductive organs. They need regular engagement to stay flexible and strong. When ejaculation stops, the contractions that exercise these muscles disappear. Over time, they tighten and lose responsiveness, making it harder to control urination, achieve firm erections, and experience intense sensation. The most overlooked part is hormonal. Every ejaculation releases a cascade of hormones: dopamine for motivation and focus, oxytocin for connection and calm, prolactin for relaxation. Together, these create powerful well-being. Ejaculation also regulates testosterone production through a feedback loop between your brain and testes. Your hypothalamus signals your pituitary gland, which signals your testes to produce testosterone. Regular sexual activity keeps this communication strong. When that rhythm disappears, the feedback weakens. Testosterone levels drift downward. Dopamine drops. You start to feel flat. The world feels duller. Motivation fades. You might notice you're not waking up with morning erections anymore, showing that hormonal and circulatory systems are changing. One patient described it perfectly. "Doctor, I didn't realize how much I'd been running on empty until I felt full again." He'd gone nearly 3 years without ejaculating. When he restored a gentle rhythm, his energy returned within weeks. His sleep improved. His mood lifted. He felt like himself again. Your body is designed to function in motion, not suppression. Healthy ejaculation restores balance, keeps blood circulating, hormones firing, and emotions regulated. Let's talk about the 4 main medical reasons why some men experience problems with ejaculation after 60. First, retrograde ejaculation. You reach climax and feel pleasure, but little or no semen comes out. The semen flows backward into your bladder instead of forward through the penis. At the base of your bladder sits a small muscular valve called the bladder neck sphincter. During ejaculation, it should close tightly, forcing semen out through the urethra. But if it doesn't close properly, semen takes the path of least resistance and flows backward. This happens for several reasons. Surgeries on the prostate, especially for benign enlargement, can affect the controlling nerves. Certain medications for high blood pressure or mental health can relax the bladder neck muscle. Long-standing diabetes or spinal issues can interfere with nerve signals. One telltale sign: cloudy urine immediately after intimacy. That's semen mixing with urine. Retrograde ejaculation isn't dangerous. It affects fertility but doesn't prevent pleasure or erections. Diagnosis is simple through a urine test after climax. Second, obstruction of the ejaculatory ducts. Your seminal vesicles produce the most semen volume. That fluid travels through small ducts to the urethra. If these ducts become blocked, semen volume drops dramatically or disappears, even though production continues. What causes blockages? Past infections, especially untreated prostatitis, leave scar tissue, narrowing the ducts. Small stones can form. Cysts or anatomical changes can compress ducts. Symptoms are subtle: pelvic discomfort during climax or semen gradually becoming thicker and less abundant. Diagnosis requires imaging tests like transrectal ultrasound. Many obstructions can be treated with medications or minimally invasive procedures. Third, hormonal deficiency, particularly low testosterone. Testosterone is the master hormone for male reproductive function. It regulates desire, sperm production, and proper functioning of your prostate and seminal vesicles. When testosterone drops significantly, the entire system is affected. Initially, you notice reduced semen volume. Then other signs emerge. Decreased libido, less firm erections, less intense orgasms. Beyond sexual function, you feel persistent fatigue, muscle loss, mood changes, difficulty concentrating. Many men dismiss this as aging, but it's often hypogonadism, a hormonal deficiency that can be treated. Diagnosis is straightforward through blood tests. If confirmed, hormone replacement therapy can restore semen production, energy, desire, and overall quality of life. Fourth, serious conditions requiring immediate attention. Certain urological cancers can obstruct ejaculatory ducts. Prostate cancer can block semen's passage. Bladder cancer near the bladder neck can interfere with ejaculation. These may be accompanied by blood in urine or semen, unexplained pelvic pain, or difficulty urinating. Progressive neurological diseases also matter. Multiple sclerosis, Parkinson's, or severe nerve damage from uncontrolled diabetes can disrupt brain reproductive system communication. Seek help immediately if dry ejaculation appears suddenly without explanation, or it's accompanied by pain, blood, fever, or loss of genital sensation. These are red flags requiring urgent medical evaluation. The vast majority of ejaculation changes relate to the first three causes: mechanical issues, obstructions, or hormonal shifts. All have solutions. Recognizing them early makes treatment far more effective. Beyond physical mechanics, there's a deeper truth I've witnessed repeatedly. When men experience changes in ejaculation or sexual function, the emotional impact can be profound, sometimes more distressing than the physical symptoms. Many men associate ejaculation with masculinity, strength, their sense of being complete. When it changes or disappears, inadequacy, anxiety, and frustration naturally arise. I've sat across from men who started avoiding intimacy, not from lost desire, but from fear of judgment or feeling incomplete. Your sexual function isn't separate from emotional health. They're deeply intertwined. When you suppress desire or dismiss it as unimportant, you're not just shutting down one aspect of life. You're closing pathways that fuel curiosity, creativity, motivation to engage with the world. I've met men who spent years ignoring sexual health, often from embarrassment or believing it no longer mattered. Almost universally, they describe feeling withdrawn, less confident, sometimes depressed. One patient told me, "I thought that part of my life was over, and without realizing it, I started to feel like I was over too." Ejaculation is more than physical release. It's an emotional exhale that resets your nervous system, lowers stress hormones, and reminds your brain that relaxation and pleasure are still possible. When you stop releasing, pressure builds internally as tension, showing up as irritability, restlessness, or quiet frustration you can't explain. Your emotions and hormones are in constant conversation. When you express desire healthily, without shame, your brain rewards you with calm and clarity. When you suppress it, your brain associates intimacy with discomfort. Slowly, the emotional door closes. That's why many older men feel invisible or numb. It's not age, it's disconnection. But when you reconnect, when you allow yourself to feel without judgment, something powerful happens. Your energy opens. You feel gratitude for simple things. One patient in his early 70s described it beautifully. "It's like I woke up after years of being asleep. I didn't realize how much I'd shut down until I felt alive again." This isn't about chasing youthful performance. It's about honoring the body you have right now, understanding its needs, and giving yourself permission to care for it completely. You understand why ejaculation matters. Now let's talk about how to do this safely after 60, especially if it's been a while. The first step is letting go of pressure. Many men carry years of performance anxiety and fear. That tension blocks the circulation and nerve flow needed for natural release. Shift your mindset. This isn't about performing like you did at 30. It's about maintaining health, keeping your prostate clear, hormones balanced, and pelvic circulation strong. Give yourself permission to experience touch, stimulation, and arousal without rushing. The process itself, increased blood flow, muscle engagement, hormonal release. That's where health benefits live. Hydration matters. As we age, we drink less water, and dehydration thickens seminal fluid, making it harder for your prostate to function. Drinking water consistently supports natural cleansing processes. Physical activity helps. Daily walks, gentle pelvic stretches, or simple yoga improve pelvic circulation. I specifically recommend Kegel exercises for men. These strengthen pelvic floor muscles, supporting your bladder, bowel, and erectile function. Tighten the muscles you'd use to stop urination. Hold for 5 seconds, release. Repeat 10 times, 3 times daily. Over time, you'll notice better control, stronger sensations, improved function. Without a partner, self-stimulation is safe and medically recommended for men over 60 to prevent stagnation. This isn't about fantasy or indulgence. It's about function. Your body needs release, just as your lungs need to breathe. For most men over 60, a healthy frequency is once or twice weekly. But listen to your body. If you feel discomfort, pressure, or heaviness in your lower abdomen or groin, that's your prostate asking for attention. What matters most is mindfulness. Let each experience be slow, calm, guilt-free. Focus on sensation rather than outcome. Afterward, take a deep breath. Feel your body relax. That calm is your nervous system resetting, hormones rebalancing, your body remembering it's alive and capable. Practical tip: warm showers or baths before intimacy relax pelvic muscles and improve blood flow. Warmth softens tissues, eases tension, and makes the experience more comfortable. If you're taking medications, be aware some affect ejaculation. Blood pressure medications, antidepressants, prostate medications. Don't stop prescribed medications, but talk to your doctor about alternatives if you notice problems. Simple adjustments can restore function without compromising other health needs. The goal isn't perfection, it's consistency and self-respect. When you make this a regular, guilt-free part of self-care, you're telling your body you still value it, you're still engaged with life, you refuse to fade quietly. There's a moment that can feel frightening. You reach climax, feel familiar contractions and pleasure, but nothing comes out. Many men experience this and immediately panic. Take a deep breath and hear this clearly. It's not the end. It's a signal. Your body is trying to tell you something important. The most common cause is retrograde ejaculation, where semen flows backward into your bladder instead of out. This is mechanical, not loss of function. It's often related to medications or surgeries affecting the valve mechanism. While it impacts fertility, it doesn't prevent pleasure or erections. Diagnosis is straightforward through a urine test after intimacy. The second reason is reduced seminal fluid production. As testosterone declines and your prostate and seminal vesicles age, their ability to produce fluid slows. That doesn't mean your body is failing. It's changing, and like any system, it needs maintenance. I remember Robert, 72, who came to me deeply worried. We adjusted his blood pressure, medication, improved hydration, added pelvic floor exercises, and supported hormone levels through lifestyle changes. Within 6 weeks, not only did his ejaculation return to normal, but he also reported better sleep, more energy, and greater mental clarity. Addressing the root cause doesn't just fix one symptom. It often revitalizes your entire system. So if this happens, don't suffer in silence. Talk to your doctor. Ask specific questions. Request tests that give clear answers. This isn't a weakness. It's your body asking for care, attention, and respect. There's a transformation I've witnessed countless times. A man walks into my office carrying quiet weight. His shoulders are slumped. His voice lacks strength. He feels slower, dimmer, less sure of himself. But when he understands and respects his body's natural rhythms, when he reconnects with sexual health, not from ego but genuine self-care, something miraculous happens. His posture changes, his eyes brighten, his voice steadies. He looks and feels like himself again. This isn't about the physical act. It's about rediscovering connection, renewal, and confidence. When you honor your body's needs without shame, you stop seeing sexual function as trivial or embarrassing. You see it as a conversation with your biology, a signal that life is still flowing through you. True masculine strength isn't defined by dominance, youth, or performance. It's defined by your ability to stay in touch with your body and emotions without fear. That's where real power begins. When you release with awareness, calmly and intentionally, you experience something deeper than pleasure. You experience relief, presence, and profound belonging to yourself. Confidence is born from this self-awareness. It's the difference between a man searching for validation and one who carries peace within himself. Ejaculation, understood correctly, becomes part of that inner balance. It's not about chasing lust. It's about allowing energy to circulate, emotions to flow, tension to release naturally. When this happens regularly and healthily, men describe feeling lighter, more focused, more emotionally open. They connect better not only with partners but with life itself. One patient told me, "Dr. Lila, after I stopped being ashamed of wanting to feel alive again, everything changed. My confidence came back because I finally accepted that I'm still a man." That acceptance is powerful. It heals more than the body. It restores identity, dignity, and hope. Every choice to reconnect, to honor your body's rhythm, is profound self-respect. The more consistently you do it, the more your inner strength returns naturally. Now it's time to turn knowledge into action. Information without action changes nothing. Reclaiming vitality after 60 doesn't start with expensive treatments or complicated routines. It starts with a simple decision to stop ignoring your body and start listening to it. You don't have to overhaul your life overnight. Just take one small, intentional step back toward connection. You can begin tonight. Step 1. Awareness. Take quiet moments, free from judgment, to reconnect with yourself. Think honestly about how long you've been suppressing natural urges. How often have you dismissed them as inappropriate for your age? Understanding those signals isn't a weakness. They're reminders that your body is still vital, still functioning, still asking to be acknowledged. Feel gratitude that your system still works, still produces energy, still invites you to engage with life. This simple awareness begins restoring balance between mind and body. Step 2. Gentle reintroduction. Don't rush, don't force. Start slowly with relaxation and patience. Gentle touch, mindful stimulation, or simply allowing arousal without expectation of climax. These awaken your body's rhythm safely. The goal isn't performance, it's a connection. With each experience, you're improving blood flow, easing tension, and reminding your brain that pleasure and release are part of your natural design. Think of this as physical therapy for your masculinity, a gradual return to strength and confidence. Step 3. Reflection. After release, don't just move on. Pause. Notice how you feel physically and emotionally. Most men report calm, clarity, and quiet confidence that lingers. That feeling is your nervous system resetting, hormones realigning, your body thanking you for letting it do what it was built to do. Take pride in that moment. It means you've taken real control of your health in a way most men never do. These 3 steps may sound simple, but they're profoundly powerful. When practiced consistently, they don't just restore physical function. They restore identity, connection to life, feeling of wholeness. And here's what surprises most men. When you follow this path, the changes don't stay hidden. They show in your eyes, your voice, the way you carry yourself. People notice, you notice, and that quiet transformation changes everything. Gentlemen, Ejaculation after 60 isn't about chasing youth or proving anything. It's about acknowledging that your body still speaks the language of life. Every release, every moment of intimacy is your body's way of staying balanced, strong, and awake. When you ignore it, you drift away from yourself. But when you honor it with awareness, patience, and respect, you begin to feel whole again. You sleep better. You think more clearly. You move through days with quiet confidence. That's because your hormones, circulation, emotions, all of it starts working in harmony the way nature intended. So if you've been waiting, if you've been silent, if you've been unsure, this is your moment to begin again. Don't let anyone, including yourself, convince you that this chapter is over. You have too much life left to live. Treat your body with care, honor its signals, embrace its rhythm. Because inside you right now, there is still a fire that never went out. It's just been waiting, patiently, for you to notice it again. If you found value in this message today, please share it with a friend, a father, or a brother who might need to hear this. And subscribe so you don't miss our upcoming videos on men's health. I'm Dr. Lila Romano, and I'll see you in the next video.